I'm Michelle Collins, certified nurse midwife and professor of nursing at Vanderbilt University School of Nursing, talking about how to recognize the signs of labor. Well, the signs of labor actually can begin to occur up to 2 weeks prior to the onset of the big day. And some of the signs that you might see that will tell you that your body's getting ready for labor, one is that the baby lightens or drops down in the pelvis. And we call this lightening because women feel lighter. It's easier to take a deep breath. The downside is that they have more pelvic pressure and they have to go to the bathroom more often. Sometimes it's not the woman who notices the lightening, but the people around her who will tell her, oh, I can tell that your baby's dropped. Another sign that labor may be coming is an increase in Braxton Hicks contractions, and those are the practice pains of labor that women get, that their uterus actually practices contracting. A woman may actually lose a pound or two in the last few weeks of pregnancy due to the shifting estrogen and progesterone levels from her that her pregnancy produces. She also may have an increase in discharge vaginally as the body produces a few more white blood cells in preparation for the birth. She may lose a mucus plug vaginally, which looks just like a large glob of mucus, and sometimes it's streaked with a little bit of pink or a little bit of blood. And that's just as the cervix is beginning to loosen and soften, it discharges that. She also may have a nesting instinct where she feels great, just starts cleaning the entire house and packing up all of her things for the hospital and just feeling incredibly energetic, and we call that the nesting instinct. As far as a more close event as far as labor onset, a woman will usually experience regular uterine contractions that are coming with regularity, that are strong, that she cannot talk through or walk through, and that her uterus feels very, very firm at. She also may experience a rupture of membranes or the breaking of the waters, and that can occur just spontaneously with no contractions at all, although that's kind of rare, only about 10% of the time, or it may occur in the process of having contractions. Anytime a woman has the warning signs of a headache, blurry vision, double vision, tunnel vision, severe pain in the upper gastric area here, or sudden swelling in her face, hands, or feet, she should always call her provider, regardless of whether she's having any of these other signs or symptoms of impending labor.